As the world marks World TB Day today, the global fight against tuberculosis is under renewed focus, particularly in the high-burden countries like Mozambique. According to the World Health Organization, an estimated 112,000 people developed TB in Mozambique in 2023, with around 17,400 cases going undiagnosed each year. Despite ongoing efforts, TB remains one of the leading causes of death in the country, with thousands of cases still going undiagnosed each year, especially among people living with HIV. Well, to speak to us a little bit more about this, we're now joined by Helen Hallstrom, who's the Senior Partnership Officer at ADPP Mozambique. Thank you very much indeed for joining us, Helen, and welcome.
Thank you very much.
As the world marks TB Day, give us a sense of the situation on the ground in Mozambique and how it compares with the rest of the continent. It is a serious problem, we understand.
Yes, Mozambique is one of the 30 high-burden countries in the world. As you said, there are many people who get sick with TB every year, around 100,000. And despite their progresses, there still remains a lot of challenges where many people are undiagnosed, and especially the multi-resistant TB is increasing, and people face a lot of challenges in complete the treatment who has multi-drug resistant.
Why are so many cases going undiagnosed each year, Helen?
So there are various factors. Many people in Mozambique still lives in poverty. So the catastrophic cost, the transport cost to go to the health facility where they still live in a long distance. But there are also still a lot of myths and misconception, the lack of proper information about TB, which means people are not seeking the health facilities. Instead, they go to the traditional healers or do not go at all because they think it's something else. And then there are a lot of underlying causes that also contributes, like chronic malnutrition, and in some cases is alcohol abuse as well.
I'm curious also about what you think can be done to reduce these numbers, Helen.
Yeah, so what we can see is community engagement. It's really a game changer in the TB response. So when we are seeing people lack information, to involve community leaders and community health workers, that really makes a big difference because they bring a trusted environment to educate the peers in a more simple way. What is TB? How can it be prevented? And when you have the symptoms, what should you do? But also to have community health workers to do the screening and referral and even collecting of the sputum. So bringing the health services closer to where people there live, so to reduce the catastrophic cost, that is really making the big difference.
We know that there's medications, vaccines available, but there is this growing concern about drug-resistant TB. Is that something that's coming through quite a bit in Mozambique as well?
Yes, drug-resistant TB, it's a big concern. So there needs to be done a lot more in the actual prevention so people do not develop drug-resistant TB. So the upcoming vaccines, hopefully it can be part of making a big difference. However, there still needs to be done a lot of work to explain about the vaccines, to have an acceptance to the vaccine when it comes.
What's your most important message to the public on a day like today?
Yeah, a big message is TB is an urgent issue, but at the same time, it is an opportunity because we have the knowledge today how to combat TB. And by engaging the community, it's not something we can do, it is a must, because we can see this is making the big difference. It's a game changer in TB response.
Helen, thanks very much indeed for joining us and giving us some insights on TB in Mozambique, but I think lessons for everybody across the continent. Thanks so much indeed for your time.
Thank you.
That was Helen Hallstrom, who's a Senior Partnership Officer at ADPP in Mozambique, talking to us on World TB Day.
Well, we now enter the third and final hour of Rise and Shine. Thank you for choosing us to